Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
manifestations of Conn's syndrome. So what is Conn's syndrome? Conn's syndrome is a primary hyperaldosteronism. Now, in a patient with Conn's syndrome, actually, first and foremost, in Conn's syndrome, what happens? If you see in Conn's syndrome, there is increased aldosterone. Okay, this increased aldosterone will cause increased sodium and also absorption, because along with this sodium, even water undergoes absorption, and there is increased potassium excretion will occur. So as a result, because of increased sodium and water absorption, there is increased plasma sodium causing hypernatremia. Okay, increased water will result in hypertension in the patient. There is no edema because of compensatory effect of the kidney, and increased potassium excretion will decrease the plasma potassium levels. Okay, there will be hypokalemia. This hypokalemia will result in muscle weakness and fatigue, and there is hypokalemia also. Obviously, there is increased aldosterone, and whenever there is increased water and sodium absorption, that means there is increased volume in the blood. Because of increased blood volume, this inhibits renin, so there is low renin is seen. So all the features are explained, right?
thank you and thank you for watching.